Have you ever wondered if the health tests you trust are really protecting you or silently putting you at risk? Millions of seniors over 70 believe more tests mean better health, but today we uncover 5 common tests that may quietly harm more than they help. From unnecessary radiation exposure to the stress of false alarms. The truth is that for those over 70, some routine checks can lead to a cascade of problems. We're not just talking about theories. We're resharing real stories and expert insights that challenge what we've been told about staying healthy in our golden years. What if the key to a longer, healthier life isn't more testing, but smarter testing? Stick around as we reveal the 5 tests you might want to question after 70. What we share could change the way you approach your health forever. Have you ever heard the saying, "If it ain't broke, don't fix it"? Sometimes, in our quest to find problems, we end up creating them. Let me tell you about Linda. At 75, Linda lived a full and happy life. Her days were filled with the simple joys of painting beautiful canvases and taking long, peaceful walks in her neighborhood. She felt great, energetic, and healthy. During a routine checkup, her doctor recommended a bone density scan, also known as a DEXA scan. It sounded like a simple, precautionary measure. The scan came back showing what was described as mild osteopenia, a slight thinning of the bones, which is actually quite normal for someone her age. But instead of reassurance, this result led to a prescription. Almost immediately after starting the medication, Linda's life took a turn. She developed severe jaw pain, making it difficult to eat or even talk. Painful acid reflux kept her up at night. She went from feeling vibrant and active to being miserable and in constant discomfort for weeks. All this suffering was for a condition that was essentially a normal part of aging. The scan, meant to prevent a problem, ended up creating a very real one. Linda's story isn't unique. It highlights a growing concern in medicine: the risk of overtreatment. A test result on a piece of paper can trigger a cascade of interventions that might cause more harm than good, especially when the initial problem wasn't really a problem at all. Thankfully, Linda's story has a happy ending. After stopping the medication, she focused on what truly supports bone health. She started using resistance bands for gentle strength training, made sure to get plenty of sunlight for vitamin D, and filled her plate with nutrient-rich, healthy foods. Slowly but surely, the pain subsided, and her energy returned. She was back to her painting, her walks, and her life. Linda's experience teaches us a valuable lesson. It's crucial to have open conversations with our doctors, to ask questions, and to understand the real-world implications of a diagnosis. What are the risks and benefits of a treatment? Are there alternative lifestyle-based approaches? Sometimes, the most powerful medicine isn't found in a pill bottle, but in the choices we make every day. It's about building a foundation of health through movement, nutrition, and well-being rather than reacting to a number on a chart. What do you think about routine screenings like this? Share your thoughts in the comments below. Thanks for watching, and if you found this story insightful, please like and subscribe for more content that empowers you to take charge of your health. Let's talk about Thomas. At 72, he started noticing he was a little more forgetful than usual. Misplacing his keys, forgetting a name here and there. Small things, but they worried him. Fearing the worst, maybe the beginning of dementia or something more serious, he went to his doctor. His doctor recommended a brain MRI just to be safe. The day of the scan was not. The loud, rhythmic sounds of the MRI machine seemed to echo his own anxieties. A few days later, the results came in. The scan revealed several small, bright white spots on his brain. When he saw the report, his heart sank. What did this mean? Was this the confirmation of his greatest fear? Immediately, his mind jumped to the worst-case scenarios. Those white spots became the source of immense fear. He spent months consumed by anxiety. Nights were sleepless, filled with worry about his future, his independence, and the burden he might become on his family. He went through a battery of unnecessary follow-up tests, each one adding to the stress and uncertainty. Every normal cognitive test result felt temporary, like the other shoe was about to drop. But here is the crucial part of Thomas's story that he didn't understand at first. Those white spots were completely normal for his age. They're incredibly common in people over 60 and, in his case, were harmless. They weren't a sign of dementia or any other scary disease. They were just a part of the natural aging process of the brain. This story highlights a really important point. While medical imaging is a powerful tool, not every finding, not every abnormal result on a scan is dangerous. Sometimes, seeing something unusual can create what we call incidentalomas findings that trigger a cascade of fear, anxiety, and more testing, only to discover they were benign all along. The psychological toll of this process can be heavy, turning a mild concern, like Thomas's forgetfulness, into months of genuine suffering. It's a reminder to always have a thorough conversation with your doctor. Ask questions. What does this result really mean for me? What are the next steps? And remember, a picture of your brain doesn't tell the whole story of your health. Thanks for watching. If this story resonated with you, please like and subscribe for more content that matters. Have you ever felt a little out of breath walking up a hill? Maybe you just shrugged it off, thinking you were having an off day. That's what 76-year-old Martin thought too. He felt a bit more tired than usual during his daily walks, so his doctor recommended a cardiac stress test just to be safe. It sounds like a reasonable precaution, right? But for Martin, this simple test spiraled into a cascade of medical interventions that he never actually needed. The stress test came back with an unclear result. This is what we call a false positive. It suggested there might be a problem with his heart, even though he was feeling generally fine. Because of this ambiguous result, his doctors recommended an angiogram. This is a more invasive procedure where they inject a contrast dye into your blood vessels to get a clearer picture of your heart. Martin agreed, trusting the medical advice he was given. During the angiogram, they found a blockage, or at least what they thought was a significant blockage. So they immediately proceeded to place a stent to open up the artery. A stent is a tiny tube that props open a blood vessel. It sounds like a lifesaver, and it can be. But here's the twist. A later review of Martin's case suggested the blockage was unsevere enough to require a stent in the first place. The initial stress test had set off a chain reaction of treatments that might have been entirely unnecessary. But the story doesn't end there. The contrast dye used during the angiogram took a heavy toll on Martin's kidneys. He developed a kidney injury, a serious complication that required him to spend several days recovering in the hospital. What started as a simple feeling of tiredness on a walk ended with an unnecessary stent, a kidney injury, and a stressful hospital stay. Martin's story is a powerful reminder that sometimes more testing doesn't lead to better health. It can create its own set of problems. A tired day doesn't always mean you have heart disease, and it's crucial to have a thorough discussion with your doctor about the potential risks and benefits of every single test. Thanks for watching. If you found this story insightful, please like this video and subscribe to our channel for more content that helps you navigate the complexities of healthcare. Stay informed and stay well. Have you ever heard the saying, "If it ain't broke, don't fix it"? Sometimes that advice can be surprisingly relevant, even in medicine. Let's talk about Eleanor. At 74, she was the picture of health and happiness, often found in her kitchen, baking for her family. She had no symptoms, no complaints, nothing to suggest anything was wrong. But during a routine checkup, her doctor strongly recommended a colonoscopy just to be safe. It's a common screening test, right? So Eleanor agreed. During the procedure, they found a tiny, harmless-looking polyp and removed it. On the surface, it seemed like a successor problem caught before it could even start. But that's not where Eleanor's story ends. Shortly after the procedure, she started experiencing severe complications. It turned out she had internal bleeding, a rare but serious risk associated with colonoscopies. What was meant to be a simple, outpatient procedure turned into a nightmare. Eleanor was rushed back to the hospital, where she spent a frightening week with her family, who just days before were enjoying her freshly baked cookies, now sat by her bedside, worried and anxious. Her recovery was slow and difficult. The experience took a significant toll on her, both physically and emotionally. It makes you wonder, was it worth it? For Eleanor, a preventative test meant to offer peace of mind instead caused immense pain and stress. Her story highlights a crucial conversation we need to have about medical procedures, especially for older adults. As we age, the balance of risks and benefits for certain screenings can shift. For individuals over 70, especially those without symptoms or a family history of colon cancer, The potential harms of a colonoscopy, like bleeding or perforation, can sometimes outweigh the benefits of finding and removing a small polyp. This isn't to say that colonoscopies are bad. They are life-saving for many people. But it's a reminder that medicine isn't one-size-fits. It's essential to have a detailed discussion with your doctor about your personal health, your age, and your specific risk factors. Ask questions. Understand the potential downsides, not just the upsides. Making an informed decision is your right. Eleanor's story isn't meant to scare you away from medical care, but to empower you to be an active participant in your own health journey. What are your thoughts on this? Have you or a loved one had a similar experience? Share your story in the comments below, and if you found this perspective helpful, please like this video and subscribe for more content that challenges us to think differently about health. Thanks for watching. Have you ever thought about getting a full body scan just for peace of mind? It sounds like a great idea, right? A high-tech way to catch any potential problems early. Well, let me tell you about Harold. Harold is 79, active, full of life. You might see him at a martial arts class, always smiling. He decided to get a full-body CT scan just to be on the safe side. The scan found something, a tiny 2.5 mm nodule. It was so small, almost insignificant, but the report flagged it, setting off alarms. More tests were ordered. For that tiny dot, doctors recommended a biopsy. It seemed like the responsible thing to do, but during the procedure, something went wrong. The biopsy needle caused a complication, and part of Harold's lung collapsed. What started as a quest for peace of mind turned into a nightmare. Harold spent 9 long days in the hospital, recovering from a procedure he never would have needed if not for that initial just-in-case scan, and the result of the biopsy, Gabe. After all that pain, worry, and a 9-day hospital stay, the nodule was benign. It was completely harmless. Harold went through a life-changing scare, all because of a tiny dot that meant nothing. This brings up a crucial point that we often overlook in our quest for health. More scanning doesn't always equal more safety. These powerful technologies can find tiny abnormalities that are statistically more likely to be harmless than harmful. But once they're found, it often triggers a cascade of more invasive, riskier tests, what we call the cascade of care. This can lead to unnecessary anxiety, complications, and significant costs, both financially and emotionally. Harold's story isn't unique. Many people are caught in this cycle. A scan meant to reassure them ends up causing real physical and emotional harm. It's a powerful reminder that every medical test, no matter how routine it seems, has potential downsides. It's essential to have a conversation with your doctor about the real risks and benefits before jumping into a full-body scan. Sometimes, the wisest choice is to question whether more information is truly better information. Thanks for watching. If this story made you think, please like and subscribe for more content that goes beyond the headlines. See you next time. We've heard some powerful stories today, haven't we? Stories that go beyond just numbers and test results. They get to the very heart of what it means to be healthy. And what they show us is that true health isn't just about catching something early. It's about so much more. It's about protecting your peace of mind. It's about holding onto your dignity. It's about valuing your time and, most importantly, your quality of life every single day. Think about it. We're often told to get this test, that scan, this checkup. And while that can be life-saving, it's not always the full picture. Before you agree to any medical test, it's crucial to empower yourself with one simple, powerful question. What happens next? What will we do with the information from this test? If it's positive, what are the real, tangible treatment options? Do those options align with the life I want to live? If the answer is just more tests, more waiting, more anxiety, then you have to ask if it's truly worth it. Sometimes the bravest and wisest choice isn't to say yes to every procedure offered. Sometimes the most courageous thing you can do for your own well-being is to say no. It's about choosing a path that prioritizes your happiness and comfort over a path of endless testing and uncertainty. Saying no isn't giving up. It's taking control. It's a declaration that your life is more than just a series of medical appointments. It's about the walks in the park, the time with family, the simple joy of a quiet morning. Your health is more than a scan. It's your entire life. If this message resonated with you, please share this video with someone you care about, especially if they're over 70. It might be the most important conversation they have this year. It could save them from unnecessary fear or even from unnecessary harm. Thank you for watching. Take care of yourselves and each other.